Canterbury Rehab was the first outbreak we had in a rehab facility. This was at the front end in terms of the epidemic coming to Richmond. For the entire staff, it has been really hard to walk through this and feel like that they're doing everything they can to keep residents safe, to keep themselves safe, but this virus continues to take its toll on the residents of that facility. It was, second week of March when they identified their first case. They contacted us immediately at the health department. As soon as they found out they had a confirmed case, they created an isolation wing where they isolated the COVID-19 case and then isolated any other cases that were symptomatic and potentially had COVID-19 while we awaited test results. They started cohorting staff pretty quickly, so making sure that staff were only working with those symptomatic individuals. Certainly the attrition of staff working double shifts, having to just be in that environment every day where, day in, day out, they were losing another patient. Undoubtedly, that was extremely traumatic for the staff, exhausting and frustrating. That question has been asked almost every day. Why Canterbury? Why such a significant spread of disease at that facility? That came at a time in Richmond where we were still learning about this and in terms of the behavior and the mitigation efforts that were happening here in Virginia. We've known asymptomatic transmission was a possibility from the beginning. I don't think we realized the degree to which this disease is spread before you're even showing symptoms. And so when you pair that type of spread with a scenario where you have lots of elderly, frail individuals in close contact, sometimes sharing rooms, it makes for a very difficult situation to prevent. And then nursing homes, again, haven't had to do this type of infection control prevention behavior. It's not what they're designed for. It's not what they're set up to do well. These are also residents who need a high amount of healthcare interaction, right? They not only are they seeing a doctor and a nurse every day, but they're seeing physical therapists, speech therapists, occupational therapists, and so there are just many opportunities for the virus to be transmitted from one person to another. We've kind of thought through, like, does a mandate requiring staff not to move from facility to facility make sense? And I think it does from a disease prevention standpoint. The reality is, though, that many of these facilities would be immediately short-staffed overnight if we were to pull the trigger on a decision like that. And so we've got to figure out, is there another way to limit transmission without making it impossible for some of these facilities to actually operate? I think we are still very much on the upswing of the outbreak in Virginia. I think we're a few weeks away, 3 or 4 weeks away probably from peak activity here in Virginia. Nursing homes are doing their best. They're trying to take good care of their patients, but COVID-19 is a different enemy than they've ever had to face.